Hi everybody and welcome to this concept lecture on anxiety. So today we are just going to recap our anxiety knowledge. We're going to consider the biopsychosocial elements of anxiety disorders, and we're just going to have a brief overview of some of those interventions for anxiety. Of course, some of the specific interventions for anxiety you will read about if you're choosing to do anxiety for your assessment item, but I'll give you a broad feeling for some of them today. So when we think about anxiety overview, we need to recognise that anxiety is normal. Remember that we all feel elements of anxiety. Sometimes that's in anticipation of things, exams, driving tests, those kinds of things, and public speaking, and it's about the anticipation of what will happen, and sometimes it's about both, of what will happen, but also when it's actually happening. So anxiety is normal, but it becomes unusual or abnormal when it affects everyday function. So, and is not proportional. So we often think about that. So is it reasonable for me to be anxious, to have butterflies in my tummy or feel a bit sweaty if I'm going to give a keynote lecture to, 600 people? Probably that's absolutely reasonable. But when public speaking becomes an issue, when you can't speak in front of anybody that outside of your normal, really small comfort zone, or that your throat closes over and you start to you develop a stutter, those kinds of things, or you feel like you can't swallow, that's when it becomes out of proportion. So there's a differentiation between that. That's a very kind of gross kind of example, but there is a differentiation. So when we're thinking about the domains, we think about the physical domains that people experience. So we know that with anxiety, it's a very somatic. So that means that you feel it physically. Somatic, it gives you symptoms of physical elements, experience. So people will talk about feeling nauseous, vomiting, needing to go to the toilet, for example, open their bowels more frequently, or to urinate more frequently. Some people get the shakes. Sweating is really, really common. Butterflies or knots in the tummy are often described. Can be things like headaches, tension. Some people find that they're holding themselves like this, gritting their teeth, grinding their teeth. So there could be lots and lots of somatic symptoms that people experience. We know that people experience different cognitions, ways they think, and that may well lead to emotional kind of experiences for them. So they may well become very emotional, or they may have these really, really intense emotional feelings. So we think about becoming fearful, we think about being worried, unsettled, sometimes irritable and angry. It might actually cause that level of anxiety may be so great that it causes us to act out. So you might see that word written. So we might verbally kind of, take it out on somebody else, for example. And then there's things like poor concentration, poor memory, because your brain is just so absorbed with thinking about the thing or the things, and doing some of those behaviours that help to support that or minimize that you actually, your memory is really, really impacted. So behavioural responses, so we get avoidance tactics. So with children, school refusal may well sit within somebody feeling very anxious about school, doing anything that they can to avoid doing something. So, I've got a stomach ache, I'm sick, I can't go to school because, those kinds of things. Avoidance tactics can also be things like walking the long way round, for example, if there's something in particular. So they can be very varied. Some people sort of end up with that endured acceptance, like, I've got to go through it, and they're consumed by it. And sometimes that might lead to a dual diagnosis of depression and anxiety, because that fear is so great that it actually causes that person to experience depressive experiences too. So behavioural responses may also be physical. So we might see sometimes, you know, somebody picking at their skin, grinding their teeth, bruxism. There can be a whole range of different kind of physical behavioural responses that people do as well. And social, very, very common. People with anxiety will reduce their social contacts, or they may avoid going to certain things. So there might be something workplace, you know, or going out, and they may just always say no, 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 and it's because they've got social anxiety. Remember, there's a whole range of different types of anxiety that people can get. So generalized anxiety disorder, social anxiety disorder, phobias are linked here, so specific phobias, so a whole range of things. Sorry, in the behavioural as well, I forgot to say that you might get some of those types of checking behaviours as well, and then that can tip over into obsessive compulsive disorder, so something else. But you might have heard of people that repeatedly check that they've locked the doors, for example, and that can start off as an anxiety response. Let's say something's happened actually, and somebody broke into their home, and it, you know, creates this anxiety, and then it becomes something else. I've written in social that people seek negative affirmations, and what that means is that this idea that somebody is actually seeking to make sense of their mind, so they seek people either to do the thing that they're fearful of, so they can, you know, so that they, yes, that's what I thought would happen, so I'm not doing that. It's kind of like this reverse checking and affirmation. It's, you know, something that we work through when we use CBT, you know, what do you think was happening, all of those things. And withdrawal is really, really common in anxiety, so, and it's significantly problematic, of course. Okay, so our interventions, well, I've already mentioned CBT, so we may use CBT as an actual therapy, either in a group or an individual. Now, for yourselves, of course, you're not CBT therapists, so you won't be thinking about that, but we do know that some of the interventions that we see for children and in school places in particular use CBT type principles. So we'll be thinking about some of those CBT type principles. It's recognising the behaviour, isn't it? It's recognising, one, what they're thinking. You know, I was thinking this, and the behaviour that goes along with that. So, you know, if I'm thinking this, then I do this to avoid it, and the consequence of that is. So we pull that all together in CBT. And, you know, you've got information about CBT, so I'm not going to go into that. But CBT is well established as a treatment for anxiety disorders, and talking therapies full stop are the preference for anxiety disorders. Some of these psychosocial, psychological kind of interventions, preferably. However, when we get more severe symptoms that really are impacting a child or an adolescent's function, or an adult when it comes to that, we may use SSRI medications. Now in Module 4, you've got a section on medications, just for your awareness. You know, it doesn't need to come into your assessment items, but SSRIs, so they're a type of medication that we can use for anxiety and depression, amongst others, and they impact the serotonin. So, and more severe anxiety, we would perhaps combine, usually we'd always want to combine some kind of psychosocial, psychological interventions along with medications. Very rare that we'd use medications in isolation on their own. You know, there needs to be, because anxiety is multifaceted in the way in which it impacts somebody, we'd want to use some of those other interventions too. Family therapy is another way that we intervene, and that might well be because we're looking at patterns of behaviour within a family, and we've spoken about that. And it might well be that the rest of the family need to modulate how they behave. And an example of that is a family that recognises that their child is anxious, so they do everything they can to smooth everything out. They try to avoid the child being challenged in any way. But of course, what that is doing doing is that's not actually exposing the child to anything where they might learn some of those strategies. So it's about recognising those patterns within a family and helping the family manage that. It also sometimes can be helping the family to cope with their frustration perhaps, or the way in which they interact, the things that they say, because inadvertently we can reinforce a behaviour or a feeling or an experience without realising we're doing that. Lifestyle adjustments. So when we're thinking about interventions for mental health, again, we know that sleep is important, exercise is important, good diet, and they sound so simple, but they really, really do make a significant difference. There's lots and lots of research coming out of Monash University, for example, around the food mood gut biomes, so that interaction between what's happening in your gut and how that affects your mood, and it's fascinating. So if anybody's interested, do read some of that, because there's all of this discussion coming about and all of this new research. The other things with lifestyle adjustments, as we talked about, sleep is so important for children and adolescents, and it's one of the things that goes, and it also is one of the behavioural symptoms or one of the physical symptoms that changes when somebody is highly anxious. So somebody, when they're highly anxious, may choose to go to bed more often because they're shutting the world out, and it's easier to control what happens in your bedroom, for example. Or they may find that they're not sleeping, and that might well be a symptom of it because they're ruminating, because things are going round and round and round. So lifestyle adjustments can be really important, and exercise is fabulous for anxiety. Like the feel-good endorphins for exercise, the ability to get rid of some of that excess kind of energy and tension that anxiety creates. So exercise is fabulous, but of course, to keep it going, it needs to be something you enjoy, and that's really important too. And then lifestyle adjustments may also be about de-stressing the environment or de-stressing in general. So where can you make some of those changes? Where can you bring in things like mindfulness or activities? So how can you create a child environment to enable them to kind of focus on one thing, to get rid of all that extraneous kind of thoughts? So that might be having a painting session or a craft session or those kinds of things, just to give somebody quiet time. And we know that when we're really concentrating very hard, it's really difficult to worry as well. So that can be really important. So that's where the range of targeted therapies come in. So that's where your play therapy comes in, your art therapy, singing, or any and all of those kinds of things. So that's how we would think very briefly about anxiety and some of the interventions we might do. So please read around the subject, please find out some more. Do have a look at what those early interventions are for children and adolescents, and remember that will help you with your assessments, and think about how some of those things are built into schools programs or parental programs, and some of the information that you've got on that already tells you. Thanks very much for listening.